Hi everyone, hope you're doing well. Welcome to Spill the Beans. My name is Duncan Goldie. My guest this week is Olivier Coupier, who is a French speaking, who luckily for us, he's bilingual. He's an Incubator and Accelerator Director for Eurasanté, based in Lille in France. He's got extensive experience working in, I suppose, from a finance and advisory perspective for companies like Pfizer, where he was there for 7 years, and then he really wanted to sort of be engaged with startup worlds and particularly obviously stay within the digital health spectrum. So got a job working for Eurasanté. So Eurasanté, for those of you that might not have been keeping a close eye on the acceleration programs going on in France, is a French development agency, basically based in the north of France, dedicated to tech transfer and business development in the life sciences sector. So they've got a number of different avenues for teams to kind of go through. Sort of startups, they can go into an acceleration program which assists them from seed to Series A. They can assist them with business development activities. They have institutional relations for them to leverage. They're based actually in Lille University Hospital, which is an absolutely enormous campus, and basically, it's a really, really interesting insight into an acceleration program in France and the difference between the digital health landscape in France to the UK primarily. But Olivier is really experienced around this and has helped lots of digital health startups to grow and biotech companies. So really good insight from him, and I know that it'll be really, really interesting for you guys as well. So I hope you enjoy it. Olivier, hi. Thank you so much for taking the time to feature on the Spill the Beans podcast with me today. Tell me, how are you? Whereabouts in the world are you located?
Yes, hi Duncan. It's my pleasure to be with you today with in the Spill the Beans podcast. I'm based in Lille, in the north of France. It's a little bit cloudy over here, but it's definitely okay. I'm, as you can see, based at home today because of the COVID situation. Lille is unfortunately facing another wave of coronavirus at the moment, and so most of us are working from home.
Yeah, similar situation here in London as well. But tell me about what's your working from home situation like. I understand that you became a father recently. Is that right?
Yeah, exactly. But that's okay. I told my wife to take the baby out and have a little tour in the city. So normally we should be pretty fine for the next 20 minutes.
Okay, good. If we have any crying in the background, then we'll know what it's from. Perfect. So, obviously you work for a business called Eurasanté. Before we go into those guys in a little bit more detail, can you tell me, what kind of led you to join Eurasanté? What's your career been to date so far?
So basically, I studied finance in the south of France. I'm originally from there. From Marseille, actually. So I studied finance. I had a master's degree. I did some internship in banks, in investment funds, and I wanted to see the corporate world. I didn't have at that time, it was about like 10 years ago, I didn't have the idea of, which industry I wanted to go. And I decided finally to join Pfizer and the pharma industry. I mainly worked out of Brussels in Belgium, and mainly for emerging markets, because at the time the emerging markets headquarters was based in Brussels. So I did a little bit of I did a lot of things actually at Pfizer for finance, strategic roles.
So, at Pfizer, what led you to take that role? You must have had like quite a few different roles going into the sort of corporate banking world versus the pharmaceutical world, which is, looking at the rest of your career, quite an important moment for you. What led you to choose pharmaceuticals?
Well, for the main reason was I wanted to go in the industry that basically have an impact on people, and I thought really healthcare was, something that was very interesting to go, and I wanted to see more like the corporate areas, because when you work in banking or when you work in investment fund, you see many companies, many different companies. So it's very interesting to see all those differences, but you don't feel to be in charge, right? So I wanted to go there just to see the other side, and it was my first position. So I wanted to understand more on that. And so I had the opportunity to go in many different rotations within Pfizer, both in emerging markets, helping the region and the business unit to define the strategic plan, the operating plan, define the launch of products in many different countries, from like Poland to Slovenia to Russia to Turkey to India, and all those things, all those countries. For me, the key learnings I had at the time is in healthcare, there are many different, and what was surprising me is basically that there was many different, basically health systems, and the complexity of those health systems from one country to another, that seems so the same when you look in a general view or in economic view, but when you look at healthcare and the way it's actually provided, it's actually very different from one system to the other. So it's different even in Europe, from like Slovenia to let's say other countries in the Balkans, when you have countries basically like Slovenia, where everything is reimbursed and there's no co-payment at all for the patients, and other countries where basically you have to pay for everything. So it was very interesting to work on that. So I was working for Pfizer for about 6 to 7 years. And I wanted to go back to France at the time, and I wanted to go back to the startup world, because when you work in the big corporations, it's a little bit different on how you basically can see the impact of what you're doing on a daily basis. So I wanted to go back to the startup world, and I had the opportunity to join Eurasanté in 2016. At first, I had a role as supporting startups in their funding round, in their seed round, in the Series A, helping them to do the right pitch, do the right business plan, present them to the right investors, whereas it might be VC, it might be angel investors and other. And in 2019, we've decided, Eurasanté decided to launch an accelerator. And so I had the opportunity to take up that role at the time, and it was very interesting to set up something from the beginning. And I just a few months afterwards took over also the responsibility of the Bio-Incubator that we launched 25 years ago. So maybe we'll go that also on what we do at Eurasanté, but just in a couple of words, the way we define incubation and acceleration is just incubation is from the lab to the seed round, and the acceleration is from the seed round to the Series A.
Okay, fantastic. So tell me a bit more about Eurasanté as a kind of wider business. You mentioned the lab there. Talk to me about the type of businesses, the sort of overall suite of services that you offer.
Yeah, so Eurasanté was created 25 years ago in the mid-90s. It's basically a public economic development agency for the Hauts-de-France or Northern France region. It has been created by local governments, as well as the Lille University Hospital, which is one of the biggest hospitals in France and in Europe in general. There's like 1.4 million patients every year that are coming to that hospital. So we've been created 25 years ago. We're around, we are about 100% at the moment working for Eurasanté, and we have 4 different, let's maybe call that business units. So the first one is that we provide consulting services for all healthcare companies that have a footprint in the Northern France. Whether they have their headquarters or they have just a subsidiary or factory or whatever, and we provide consulting services like HR services, like finance services, like market research, like all this kind of stuff. So that's the first thing. The second thing is that we are managing the Eurasanté Park from the economic point of view. The Eurasanté Park is basically where all the hospitals from the Lille University Hospital are based. As I mentioned, it's a very big hospital. There's like 14 hospitals, 16,000 HCPs that are working there, 1,200 scientists, 400 clinical studies are done every year, and it's a 1.3 billion budget. So it's a huge hospital and a huge campus. And in this campus, you also have the Lille University, all the med school, pharmacy school from the university, and then you have 3,000 people working on companies, and mainly innovative companies in biotech, in medtech, and in digital health. So we're helping to basically manage the part from the economic point of view. And then the third pillar and the third business unit is basically we are organizing 4 international business conventions in healthcare, and we have one in digital health called Melfit. And basically, the idea around these business conventions is that we gather startups, transfer organization from universities and other kind of labs, big corporations, as well as investors, and most of them, they are VCs. And we put all of them together, and the idea is to make sure that there's the right match that is made at the earliest stage possible, which are like seed round or Series A. And thus they are those conventions. They are quite international as well. There's like 50% of the attendees that are coming outside France. So we wanted to also give the opportunity for French startups to have that exposure internationally, and to international startup that wants to reach the French market or the European market also to get there. And the last piece of our activity is basically the Bio-Incubator and the Bio-Accelerator, and that we provide through 4 different programs. Basically, as I said, from the lab to the Series A, we provide individuals and tailor-made support for the startups, with one startup manager that manages a portfolio of about 10 projects. The startup manager are highly specialized in one area. So we have, for instance, startup manager dedicated to medtech, some others more dedicated to digital health. And we provide like strategic consulting through the years, because from the lab to the seed round, it takes on average 36 months. So we provide quite a long-term support for them. And we provide all kind of services, like we have a corporate finance team that help them to find the right investor. We have a legal consultant as well, an HR consultant. We have a communication department also that can help them to have the first website and all that stuff. So that they can focus basically on what's really matter about them and what's the real value, which is their innovation basically. So we have those programs, and in those programs we can also support foreign entrepreneurs or foreign startups that wants to reach, or they want to create their company and register their company in France and in the north of France, or they want to reach the European market. So for instance, we have the Bio-Acceleration program, which is exactly that. It's dedicated to non-EU markets, including the UK, so that wants to reach France and then wants to know more about, what's the market access here, to basically be in contact with distributors, with hospitals, and all those kind of players that are here. And we do some calls for project every quarter for that. At the moment, we have 85 startups that we are supporting. 30% of them are in the biotech industry, and 40% in medtech, and 30% in digital health. And because I know it's a little bit hard to define what's medtech and what's digital health. The way we define that is that in medtech you have hardware components, and in digital health you don't. That's the trade-off we made.
That makes sense. Perfect. So I mean, it sounds like, yeah. I mean, you mentioned there's quite a sort of full suite of services really for businesses of any stage that are looking to scale within the kind of healthcare industry through innovation, really, and obviously a really good kind of learning ground for them to do that on, being involved in such a sort of enormous campus and having those kind of clinical experts on hand as well. In terms of the businesses that potentially might be looking or considering, or maybe not considering, opening up in France, what's the kind of digital health landscape like in France? I suppose before coronavirus and before people had to use technology in order to provide healthcare pathways, but has it been something that's been a focus? I mean, Eurasanté has been around for 25 years, so that maybe answers the question just there.
Yeah, I mean, we're around for 25 years, but I mean, the digital health landscape increased quite a lot in the recent, let's say, 10 years. I think it's fair to say that. And before coronavirus, it was quite exploding for maybe 3 to 5 years. In the past, if you look at the ratio of digital health startups that we supported, maybe it was around 10% of our startups in the past, and now it's becoming 30%. And when you see the next basically batch that are coming, startup batch that are coming, it's increasingly becoming a huge number of startups are going there. So there will be some kind of consolidation in the future for sure, because everywhere in France, in Europe, you have startups that does a little bit the same thing, right? So so probably there will be some consolidation in the future. But maybe I wanted to say a couple of things. The first thing is that before coronavirus, there was already a huge understanding from the hospital and also from the different layers of governments, basically, that you need to digitalize more and more healthcare for many reasons. First of all, because it's more cost effective to do all this kind of digitalization, and also, and it might be a little bit more particular to France, is because there's not enough doctors and not enough nurses, especially in rural areas and suburban areas. And so you need to find a way to basically provide healthcare services to all these patients that might be sometimes a little bit far from the doctor, or maybe it takes too much time to get an appointment, or so you need to provide different kind of services. So what we did is that with the Lille University Hospital and another incubator, more tech incubator in Lille, is that we launched already last year a core for project for healthcare digitalization, so that they can make some proof of concept with the Lille University Hospital. But and the government, at the government level, and we can talk about more on the reimbursement landscape that already has also, like, a little bit less than 10 years, became with some specific scheme for digital health startups that have been implemented in France. But we have these different schemes, and now with the coronavirus, I mean, the governments at all levels, they are more keen, and also the hospital are more keen to increase the way healthcare is digitalized. And I want to mention maybe a couple of examples. So, for instance, we do have a startup in our accelerator today that is doing a telemonitoring for chronic patients. They do this with chronic health failure and chronic kidney disease today, with a specific program that is called Programme Étape, which is basically some kind of reimbursement scheme or early access reimbursement scheme for specific chronic diseases that have been pointed by the government as like a key focus for the next year. So it's a program that is already around from 2014, but with the coronavirus, they basically increase the pool of patients that can access to those services. And this program is about to be terminated at the end of 2021, and to be more or less like going into the regular scheme. So we do see a trend that all the specific schemes that were existing for the last 5 to 10 years and all those proof of concept they are becoming more and more regular at the moment. And the second thing that we've seen, and is also quite interesting with coronavirus, is that in the hospital, there was almost no telemedicine at all for specialized doctors and stuff like that. And the coronavirus situation basically make all those things completely mandatory, just to so that the patient can continue to get the appointment that they need. And so there are some website from the different local health organization called ARS, which is basically more like a regional body from the French Ministry of Health, that made some proof of concept also to help patients to get their telemedicine or teleconsultation. And that was quite interesting to me at the time when everything was locked down in France. That's like, for instance, my wife, she's a gastroenterologist, and she basically made 100% of the consultation with either by phone or with the specific tools that were provided by this regional body, even with quite old patients, because that's also the issue with telemedicine, is that you need to be affordable for, I mean, you need to be available for everyone, right? Not only for like the youth that knows how to use technology and those stuff. You need to be used by everyone. So even people with like 80 years old were using those things, and I thought it was quite interesting as well. And the startup I mentioned to you, also quite interesting, is that they do some telemonitoring with IoT, with an app, with tablets and all those stuff. And they see in the result that the compliance is fairly good, despite the fact that the average age of the patient is 78 years old. So it's also something that is becoming more and more common at every layer of population. I mean, obviously there are some room to improve in the future, but it's also something that is improving a lot.
Yeah, definitely. And it sounds like, a lot of the, I suppose the obstacles that, telemedicine and medtech startups face is that kind of adoption through, both patients and their age. But I suppose an interesting point would be here in the UK, the NHS is quite sort of individual in terms of each site and how they adopt things. And it's quite difficult sometimes for, new businesses, startups to get that initial traction, not just in one place, but and because they've got it in one place, it doesn't necessarily mean that they can get that adoption in another healthcare site as well. Is that the same in France as well? I know that you're focusing a lot on the north of France, but in terms of the traction that people are getting and the procurement processes, I don't know if you know much about the UK and sort of how difficult it is really to navigate, but is it easy for businesses to get some sort of market footprint over there?
So I think it really depends of what kind of startups you're looking at. So if you're looking for a startup that have a product that will be dedicated to the patients, like the one I mentioned, like New Card, basically you have to go through a national system. So once you register to the national system, you can go everywhere. But obviously, you need the sales rep to do all the jobs and to convince and to go to each and every doctor within the country to basically say, okay, well, I have that app and it's reimbursed, and you can basically use that for your patients. So you still have, ways to. It still takes some time, right? So it's not just a one-step process. No, but what is interesting is that you have all these different schemes, which is basically like Forfait Innovation, like the program ETAP for New Card, for instance, or the what is called in France Article 51, which is basically for all digital app startups or all kind of startups that have an impact on the healthcare pathway. because it's sometimes easy to have a product and that you attach the product to a defined act that already exists or that you want to create. But when you have an impact on the value chain and in the healthcare pathway, it's more difficult. So you have also specific schemes on that. And those schemes, they are national schemes. So once you get there, you can get everywhere. But that doesn't mean you get everywhere in real life, right? So you still have to go to each and every hospital, to each and every doctor, and actually get the patients. And then you also have some kind of startups that have product that is more sold at the hospital level. And then it should be a little bit like in the NHS in the UK, is that you need to go to one hospital, you do your proof of concept, and then you try to roll over once the first proof of concept is done. You have in France some kind of like tender institution for a big number of hospitals. So for instance, the biggest tender institution is called UniHA. It's basically 1,000 hospitals in France that are registered to that tender institutions. So you need to go there, and you can have also some. You need to be registered in that institution, and then you can have some buyers from the hospital that buy your product. But it's still, I mean, you still have to go to the hospital. I mean, it's not so easy, obviously, but I think compared to the UK, it's a little bit more centralized. But that doesn't mean you don't need to put the commercial efforts afterwards.
No, definitely. I mean, it sounds like, you know, with the, like you say, it's probably about a good way of saying it, that it's a little bit more centralized. And it seems like, you know, there's definitely an attractive market there for a lot of UK businesses, which I know, you know, do see France as a big kind of healthcare economy to scale in. Obviously, we've got, you know, this little thing called Brexit coming up, which is potentially going to cause some roadblocks around things like the CE mark that I know is a European, I suppose, accreditation at the moment. Do you know how that's going to change post Brexit?
That's the thing. We don't know yet exactly how things will play out in the future, because I mean, what we know is that it will not be the same. So Brexit is a one-off. So once it's done, and things can only go on one way to the other, and it won't be the exact same way. Hopefully, there won't be too many differences, so that startups from the UK or startups from France can go from one country to the other, and not so in a quite easy way. But what we know at the moment is that the MDR regulations that will be in place now in 2021, that has been postponed by 1 year because of the coronavirus, and that is basically changing the way medical devices are basically classified by Europe. Will not be the same in the UK in the future, and that there will be a specific kind of CE mark for the UK, which will be called UKCA, but we don't know yet how things will change. So it will be a very interesting. It will be a very interesting time to see how things will evolve. Hopefully, there will be some, let's say, temporary solutions in between, just so that there's no impact for the patients, or the impact for the patients will be as limited as possible. But we'll definitely get an eye on that in the next months.
Yeah, definitely. I mean, it's a challenging time, I suppose, with the whole COVID situation, but then also, I mean, people had forgotten about Brexit, I think, and then they've got that looming as well, which is coming around quite quickly. But hopefully there's some kind of collaboration between Europe and Britain, so that we can continue doing business, and obviously providing these important solutions, which in turn affect the patients, right? Which is why they exist, and improve the access to care as well. Look, I mean, we're almost out of time, which has gone past very quickly. But there's obviously a lot to talk about with the good work that Eurasanté are doing. If people did want to find out a little bit more about Eurasanté and the projects that you're involved with and the startups that you have in your portfolio, what would be the best way for them to get in contact?
Well, it will be definitely to look at our website. We are currently redesigning completely this website as we speak. So we'll have a new one in the next couple of weeks, and we will have all the startups that are in our portfolio that will be mentioned there. You have the application form, and I will really encourage you, if you're UK businesses or if you're non-EU businesses, to apply to our accelerator, and we can definitely help you to understand French. Maybe not speak French, but understand a little bit how things works here for digital health startups and digital health innovation.
Perfect. Well, it sounds really, really interesting. But Olivier, for now, thank you so much for taking the time to chat with me and explain a little bit more about the whole, I suppose, healthcare economy in France, and going through everything from the VC situation to the Brexit situation to the COVID situation and the digital health landscape over there in general, as well as the procurement side. So it's been a really, really interesting and informative discussion. But thank you again so much for taking the time.
Yeah, thank you, Duncan, for giving me this opportunity to speak with you today.
Great, no worries. Well, look, I look forward to keeping a close eye on the good work that you're doing, and we'll stay in touch.
Yeah, stay in touch. Bye-bye.
Thanks, Olivier. Bye. So that's it for us this week then, guys. Thanks so much to Olivier for taking the time to chat with me. Really enjoyed hearing his perspective on the digital health landscape in France, the differences for what they're seeing in the NHS versus France, and the avenues that are open to companies either from the UK that are looking to scale in Europe, or there might be some other companies that are listening that could really leverage the information that he's got as well. So I know that he's always open to having a chat with anyone, which is evidenced by the fact that he wanted to chat to me, I suppose. But he's a really good guy, and I know that would be open to receiving any kind of correspondence. So I've put his details in the summary of this podcast as well, along with the Eurasanté website. So have a look at that, and I'll see you guys next week.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by